personal journey of bench to bedside to boardroom, and hopefully that'll become clear over the next 10 minutes what I'm talking about. So the moniker by which I'm probably best known is plastic surgeon, but that's really just a part of the STEM activities and involvement that I do. Plastic surgery has its glamorous side, and that's definitely part of our practice, but it also has its much more demanding, much more rigorous side, involving very complex reconstruction of difficult areas where those of us with strong STEM backgrounds are actually able to use advanced technologies such as stem cell-based technologies, 3D printed skin and grafts to accomplish things that we really couldn't do at the start of my career. My start in STEM was as a student, and it was at science fairs, and I started competing in science fairs in the fourth grade. And I don't think that there's been a year ever since then that I haven't been connected to science fairs in some ways, whether, of course, as a competitor when I was younger to a judge, more currently. But it's been the impact of my various STEM leaders and guides and teachers over the years that really have put me where I am today. So, the first title that I give myself is clinical researcher, and the educational path to get there was my undergraduate degree and then medical school. I did a PhD after that. And the skills from STEM I was taught and trained in included grant and scientific writing. I did a lot of work in stem cell biology, artificial skin. Medical informatics was the main focus of my PhD work. Using stem cells from human fat continues to be something that I'm actively engaged in research and development, as we've worked on reversing radiation injury in cancer patients with liposuction-derived stem cells. We've had great success in our clinical trials and have made this essentially a standard of care for certain types of radiation injury. We also do a lot of advanced imaging, three-dimensional imaging, coupled now with 3D printing for surgical planning. We have the ability to look at people aging and seeing where things change, most notably in their face. And that's been a very helpful use of technology. Throughout that, I've tried to be a STEM educator, both in places like the anatomy lab, training medical students and residents in complex anatomy and detailed dissections, to encourage their growth as scientists. So, as a clinical researcher, which is a big part of what I do, it falls into the interests circle here in terms of what excites me. It falls into the personality cycle for me too, which is the way I like to work and relate to others, meeting with students. And it's also something that I have natural interest in, which leads to skills and abilities. So it kind of seemed like a career sweet spot for me for a while. But then, working as a clinical researcher has other limitations. And I decided that, I did want to use the rest of my training and continue work as a clinical surgeon. So I have pretty extensive clinical training, including a residency in general surgery and 3 fellowships to follow that in various subspecialty areas. And we work truly as plastic surgeons. We work from head to toe, doing craniofacial surgery, repairing cleft lips and palates, and making kids' faces whole again. We can recreate a thumb in kids that are born without a thumb with a procedure called a pollicization, creation of a thumb. And in this role, I was able to lead a fairly significant team of clinicians and investigators and researchers. And around the time I became focused on that, I started to recognize how poorly parts of our healthcare system were functioning, and made a choice to move from the bedside care that I was doing more to a boardroom setting. Those of you paying attention hopefully notice the stylized photos are changing. So taking some additional training in various things required to be a manager at a higher level. I moved on to a role of chief of surgical services and ran our OR committee for several years, and really felt I was able to make a bigger difference in that role. And then I realized at that time it was time to think a little bit about what is really the pathway future forward for scientists. And of course, there's the roles in academia and in nonprofits that I had, but there was also roles in industry. So in academia, I was able to achieve a status of professor. I was able to be a director in a not-for-profit healthcare system. And then I made a difficult choice to move from academia to industry about a decade ago, and became the vice president for medical affairs at a biopharmaceutical company, and moved into the Fortune 500 in the pharma world, which took a whole new set of skills, including drug development, clinical trials, doing a lot of governmental affairs work with primarily the FDA and sometimes the CDC. One of the things that I learned best from almost every one of my STEM teachers, including at the elementary school, middle school, high school, college, and beyond levels, was really that happiness and productivity both come hand in hand from finding your real niche in life. And we looked earlier at the career sweet spot slide, but I take you from the career sweet spot to a destroyed arm, which came in to the emergency room while I was making a choice between staying full time in industry or returning to clinical work. And it was a very complex case that took a couple months to fully recover. But it was the kind of case that really pointed out to me that taking skills from the bench to the bedside, having the knowledge from being in the boardroom are really the things that let you make a huge contribution. You work in STEM. And, shortly after I took care of that child, I made the choice to stay in clinical care and clinical research and left industry. And I'm very happy to report that particular child whose arm we were able to rebuild is now actually a medical student at our college at Loma Linda, and I'm pretty happy when I see him almost on a daily basis. So the lessons that I really learned from all of my STEM teachers all center around ikigai, which is the Japanese word for a reason for being, or really loosely put, purpose. And what that leads to is the ikigai Venn diagram, where you want to be somewhere in the shaded out area that's between at least two circles, or ideally in that red square in the middle, which is your true purpose in life. When you're doing something that you love, it's something the world needs, you're paid for it, and you're good at it. And that helps combine passion to mission to vocation to your profession to really give you a purpose. That's what STEM teachers really help everyone with. And that's really what I think is an important message I wanted to give you all STEM educators today in this closing session. So, Carlos, I kept to my time. That's my 10 minutes.
Oh, thank you. Oh, wow, Dr. Gupta, that's an amazing presentation, and you really were able to fill so much into those 10 minutes. I just have a quick question. You gave us a lot of information there. In this extraordinary time that we're living in right now, what's one thing you can tell educators to encourage them in their work?
Wow, that's that's a really good question. And it's a question that I guess we all have to think a lot about as we come up with new ways of connecting with and communicating with our students. I guess I would tell them that the importance of education has in no way diminished, and we all know that while it may be harder right now to communicate messages to our students, it's even more important now than ever. So, pull on your masks, um, tie your tie, get in front of the camera, and just keep telling your story and teaching your lessons.
I just have one more quick question. I was just wondering, of all the work that you've done, which has been the most, I know this is probably a difficult thing to ask, but of all the work you've done, which has been probably, in your estimation, the most challenging type of procedure? I mean, you reconstructed so many different areas of the body. What's the toughest, you think?
The most technically challenging procedure is always related to the things that we do under the microscope, where we're using sutures that are the diameter of your hair to sew blood vessels and nerves that are less than a millimeter in diameter
Oh
to
my goodness.
restore blood flow. So there's specific cases where parts of the body are obviously through accident removed, and we need to reattach them. Of course, that includes things like fingers, ears, noses, other appendages that we'll spend 20 to 24 hours in the operating room under the microscope,
Oh my
hooking up the
goodness.
small structures. There's no doubt that's the most technically challenging stuff we do.
That is amazing. Well, just on behalf of our STEP committee and all of our attendees and our teachers, thank you very much for speaking to us, and we really appreciate you. Let's give him a virtual round of applause. That was really amazing, and thank you for your work, especially during this time. Goodness gracious! And just so you know, we are recording these sessions, and please, people are giving virtual claps for you, Dr. Gupta, and you'll be able to
All
have
right.
access to this. And he's put his information, so you can contact him if you have any other questions or anything you also want to talk to him about. Fantastic. Thank you. Oh my goodness, that's fantastic. All right. Thank you, Dr.
Great. All
Gupta.
right. Well, thanks.
Wow. That really is amazing. All right. So we move from that very amazing talk to something else that's amazing. It's another a reminder. I think Dr. Gupta reminds us of the power that STEM technology, engineering, that those things can have on people's lives. When you see a child that's had such a devastating injury, for example, or like the example that he showed, a life-altering injury, and now the child, the person's a medical student. When you see that, you really see the power of what we do.